a few of you. Welcome to everyone who's not been here before. Welcome back to everyone who has come and visited. Word up, this is this place. It's a community bookshop, clearly, but also a community art space. We host a lot of different kinds of events. Pre-pandemic, there'd be multiple events in a day for all ages and all languages, all disciplines, all formats, community meetings, etc. Since the pandemic, we've done some events outside, and I think all of it, the point of it all is just to be a gathering spot for the community. 11 years ago when we first started, we started as a pop-up shop. It was supposed to just be a 1 month long project, but there was so much community support for the space. People were really putting pressure on other neighbors who might be able to keep it open, who put pressure on the elected officials, who eventually just negotiated with the landlord until we were at that original location for over a year. When a new landlord closed it down, we then, the volunteer collective that had built up over that year stayed together until we could fundraise and make this space a reality. But we say the collective, we say us, but we also mean all of you and everyone who wants to be a part of making this place what it is. And so I invite you to also to organize here, to do meetings here, to just come and use the space as much as you can. And also clearly to buy books. And I think the best way to do both, to support both the space and the author and the events at Happy Here, is to buy the book. I know that there are some other giant sites that maybe sell the book for I don't know what discounts, but the thing about doing supporting locally owned bookshops is that money circulates in the community and stays here, and then feeds back into whatever you might do too as a neighbor. So I really appreciate you all being here tonight. I'm also really excited, not just about the talk that's going to happen between Merlin Chowkwanyun and the esteemed Dr. Robert Fullilove. I talked to Coach Dave so much and Dr. Bob. But there's the official bio. You can read on the back of the book or on our website. But what I want to talk about is how I know Merlin originally. We've known each other for maybe 20 years, almost 20 years. And we met through the college radio station, at least we both went to college. But more importantly, there's a lot that I didn't even really remember until I was until you started doing classes at this other location we have, that a lot of there's a lot you learn, through people, through talking, through meeting your neighbors, through what's on the streets, through protests, through activism that's live in person, and that's really important too. But I think there's this group that Merlin had started back in college called Radical Book Group. That was an email list that where people were sharing articles, book recommendations, and there was a lot then that. It wasn't necessarily my introduction to radical politics overall, but just in terms of the texts and who to go down, who's worth going down a rabbit hole for, to sort of frame, some things and give context to the things that you're looking at while you're in this interesting transitional point in life. So I really appreciate that, and I think that is really, now being able to program events and curate inventory at a bookstore. I think while I was thinking about this event happening, I realized how sort of foundational that was. And so now that Merlin has his own book, great. And this is something that's been not just on our minds, especially in the past 2.5 years, health politics, and what you can do locally, but it's something that Merlin's been studying for so long. So I really look forward to what we'll hear. And so I believe you're going to read. You're going to talk about the book, and then you'll be in conversation with Dr. Robert Fullilove.
I'm really excited to be here on a couple of counts. One is it does warm my heart when I reminisce on how I met Vern, and more recently, just to swap one tale for the other, Vern bailed me out last fall because I teach at the university down the street, and I don't know if this is news to you, but it is very anti-union, and so our grad students were on strike because they wanted the union to stop stalling the recognition process and bargain. So, you know, some of my students in my class were in the union, and so I said to them, well, we could have an issue here. Who do I talk to in the union? So I went to the union rep, and I said, well, you know, I don't want to do anything that looks like I'm undermining your efforts. And they said, well, one thing you could do is hold the class off campus. So I went, okay, but you know, real estate in New York, it's hard to find space. So I said, oh my God, what am I going to do? I was like looking at Airbnbs and like be frightened at the costs of this stuff. So I called Vern, and Vern said, no, relax. And we actually held class for the duration of the strike for 5 weeks at the, I guess, #2 site for Word Up, recirculation, 3 minutes from here. And I thought it was a really good experience, both because we respected what the union was doing, but also because students got an education about how strikes, what happens during a strike, and they learned a lot about Word Up. So it was a very interesting pedagogical experience for me, and I think a learning experience for the students. I also just want to say thank you to my colleague, Bob Fullilove, for being here. Thank you. Bob is in a cool position that I will never be in, which is being both an important historical figure himself and a historical analyst. So for those who don't know, Bob is a very humble person, but he was an important member of a very important, perhaps one of the most important social movement organizations in American history, the Student Nonviolent Coordinating Committee in the 1960s, which organized voting rights drives in the Deep South, and then later in cities in the United States, and I was very much center to that. So I wanted him here to draw on, frankly, his wealth of knowledge that you only get through that kind of very rare experience. So thank you. The last thing, I do this at the front of every event for this book. So you can buy this book, but this isn't like a crass plug to buy the book to line my pockets. I would like you to line Word Up's pockets. I like the press that did the book. I thought they did a nice job. They have a very UNC press. They have a nice commitment to social justice-oriented books. But then, you know, after Word Up takes their cut, UNC Press takes their cut, then Merlin gets his cut. And what I've decided to do for this book is donate all my cut, my residuals, to the Association for Flight Attendants, which is a union headed by a woman named Sarah Nelson. Sarah Nelson has been kind of at the forefront of a new type of unionism called social justice unionism, where unions are not just bargaining for great contracts and high wages and high benefits, although that's an important thing for a union to do, but also connecting the union's efforts to broader kind of community issues and social justice issues, particularly ones that affect people who might not be able to join a union, which is actually the overwhelming majority of the country. And so Sarah has set up a little fund for in her union to help flight attendants if they go on strike or if they're affected by a natural disaster or something like that, which often happens actually because a lot of the transit hubs are located in places that are prone to hurricanes and tropical storms and things like that. So all proceeds go to Sarah and her union. All right, so I said I didn't want to be that guy, so let's get on with it. So I'm going to proceed in just 3 parts, very quickly, outline the concept of the book, and then just talk briefly about some of the cases that are in the book, not all of them, of course, and then really get to what I think is important and what I think is good fodder for a conversation with Bob, which is talk broadly about some of its implications for the present and what is the relationship between local struggles and struggles at other scales, federal level, global level, etc. So I thought I might start with just the title of the book. So the title of the book is All Health Politics is Local. And I ripped this title off. It was not my idea. I ripped it. It's a total rip-off, shameless, from a guy named Tip O'Neill, whom some of you may remember. Some of you maybe probably not born yet during his heyday. But Tip O'Neill was kind of like the Nancy Pelosi of his time, although a much more effective legislator in many ways, and very great tactician. And he was kind of Democratic majority leader in the House for many, many years. And he came up with this brilliant phrase, all politics is local. All politics is local. And so what did he mean by that? He said the big changes in American politics, like the big swings in civil rights, or in the backlash to civil rights, or something like abortion, it doesn't actually come from the top in Washington, D.C. It trickles up from the local neighborhood level, block level, everyday life scale. And so to really understand why things happen in the United States, you can't just look up there at the level that C-SPAN and CNN tend to cover. You got to look at the bottom where people actually live in their day-to-day lives. And if we're talking about something like the rise of Trumpism, where does that happen? It kind of happens with that guy, but it also happens, some really deep-seated resentments at the lower kind of micro level. So, all politics is local. I said, that actually makes a lot of sense for public health. So I just stuck the word health in front of Tip O'Neill's phrase, and I had a title. And it made sense for public health. It always kind of intuitively made sense for me because I think a lot of national level stuff in public health, so you come up with some program at a foundation or in Washington, D.C. or something, actually has to be implemented on the ground, right? So you can have something like Medicare or Medicaid, but you actually have, when it comes to the actual use of it, it's at a local institution of some sort. And I don't actually think public health as a field actually captures this local dimension quite well. So Bob and I teach at a public health school. The majority of the research is kind of this very data set heavy, quantitative, national stuff. Lots of charts, lots of tables, often very useful, but it really doesn't kind of capture the essence of what's out there and how that helps your health or puts your health at risk. So it's kind of just, you get kind of lost in a quantitative statistical thicket. And the thing a lot of people in public health are actually after is this thing called generalizability, this idea that you can just kind of take some group, a group of 10,000 people, study them, and then come up with these generalizable propositions about how health works, what causes good health, what causes bad health. And this book is an argument against that. It basically says there's no such thing as generalizability, and you have to look at these very specific local contexts to see why a public health program is successful or not. So I have two basic twin goals for this book. I mean, one is to change, as I just said, change the optic, what I've been discussing. I want you to think, when you think about health, not in this kind of national level, context-free way that is not grounded. I want you to actually look not 30,000 feet up, but 1 foot up at what is happening on the ground. So one is to try and just change the lens the lens with which you interpret health and think through health. And the other, and I'll get to this in a bit, is to capture what I call a local moment. So there was a huge interest in the history of the United States, especially, I would say, starting in the 1950s and going into up to the 1980s. So between the 1950s and the 1980s, there was just a huge faith in local, community, ground level action for bettering health. And it was great and very successful in many respects, this local moment between the 1950s and the 1980s. But there are also some real limits of the local community strategy. And so that's kind of part of what I explore in this book, the real potential of local movements, but also some of the real barriers that local action runs into. So that's basically the kind of framework of the book, is I want you to see things through this local optic, and I want you to kind of understand this local moment and why it had its glorious kind of peaks and why it also encountered some difficulties in the 1980s. So for the second part, I think I'll just go through like 3 stories in the book very quickly, and then kind of get to some of the implications of these stories and the discussion with Bob. So first, I'll start with something that I think is really upbeat about the book. So a lot of historians, frankly, like to tell, and with lots of justification, all that is terrible in U.S. history. It's not hard to do that, and there's plenty of terrible in this book. But I also didn't want you to just leave with this kind of doomsday fatalistic story that nothing can change. And so I actually highlight some real triumphs, I think, of this local moment. So one of the things in this book is, while I want you to focus on the local, I don't want you to ignore what's up there. But in the 1960s, there was just this huge wave of legislation, legislation sponsoring all kinds of health programs. And we know Medicare and Medicaid as the 2 big ones, but community health centers were another one. They were basically funds so that these little clinics could open up in places all over the country. In Los Angeles, in Cleveland, there was a famous one in Mound Bayou, Mississippi, in Roxbury, near Boston. One of the fascinating things about these clinics, besides the fact that they existed, was that there was also this rule attached to them called maximum feasible participation. This is actually in the legislation. It said that, well, if you want to open this clinic and you want the federal money, we'll give it to you, but you have to ensure maximum feasible participation of the poor. And that came to be interpreted as meaning you can't just have physicians and fancy professionals running these clinics. You actually have to have a governing board of lay people who are not physicians, who are not nurses, who are not academics, who it was thought could kind of convey what the community's actual needs and wants were. And I think this is just an absolutely radical experiment when you think about it, because when you think about healthcare, it's probably the most exclusionary, hierarchical, racist, historically, institution there is. And so for there to be a law that says, now we're going to open the gates so that people who have never been allowed into medicine are not only going to be allowed to use the clinic, but are actually going to have an active say in who gets hired there, what the clinic prioritizes. Very radical thing. And so I study a bunch of these in the book. One of them is one where a lot of my students work, actually. It's in Chinatown, in the Chinatown Lower East Side area, Gouverneur. Some of you may have, I'm sure all of us have actually walked past it, but this was a community health center. Its origins were in this program. There's another one that I'll talk about in a minute that opened up in the Watts neighborhood of Los Angeles. So it's, these were really kind of innovative centers for that reason. Both the community participation part, I think they were jobs programs in many ways. One of the critiques of some of the social policy of this period is that they tended to fund things, and then once the grant money ran out, the program was over. But these centers have really stuck, and they've been very important training opportunities and opportunities for occupational and career mobility for the people in their neighborhood, in addition to providing health care. But the success of these community health centers also exposes some of the limits. So I said that there are thousands of them all over the country. Well, guess what? The thousands of them all over the country are not enough, not nearly enough to service everybody who actually needs healthcare. So in terms of scale, it never really amounted, and still doesn't amount to much more than kind of a patchwork system. And so you can have an amazing community health center type of model, like the one at Gouverneur and several others in our city, but ultimately, sometimes it feels like it's just kind of one success here, one success there, one success there, but it doesn't really add up to kind of a total system of some kind, of some sort of something kind of more structural. And the other problem is, in the 1970s, the United States becomes mired in very severe recession. It cost Jimmy Carter his presidency.
It leads to the election of Ronald Reagan, who takes a budgetary axe and starts just cutting all kinds of government funding. And community health centers really struggle during this period of kind of stringent budgetary cuts and austerity and kind of the era that we live in. So they're hatched in the 1960s where there are abundant resources, and then 10 years later, there's a very severe recession, worse than any since the Great Depression, and we're kind of still living in the residue of the shadow of that era, I think. And so this is another limit to local initiatives. What do you do once the resources start drying up? The second case is kind of related to that, but it's I zoom in a little bit more, and it's the role, and I was very surprised by this. I don't think Bob would be surprised by this because he lived through this, but it really jumped out at me, and it's the role of the 1960s riots or uprisings. I use the word riots in the book because that's the term that was used at the time, but I actually prefer the term uprisings. But the 1960s uprisings that took place in New York, Los Angeles, cities like mid-sized cities like Rochester, Newark, Detroit, these actually catalyzed a ton of community health infrastructure, which really surprised me. But city after city that I looked at, it was really obvious to me that this was the thing that really kind of forced institutions or municipalities that had long ignored certain populations in those places from actually having to respond. So, riots are often interpreted incorrectly as just these irrational disturbances and people just destroying things for the heck of it. And nothing could be further from the truth. And, Bob and I actually co-teach a class, and we were talking about some of the things we might assign. And Bob is going to do a unit on something called the Kerner Commission, which was this national study with a very simple question: why do people riot? And the report, it's a lot of data and tables in the report, but the answer is pretty elegant and simple. And it's people riot because they're tired of being exploited and they don't have resources. And one of the resources that both the Kerner Commission and also all these local commissions that I looked at, particularly in Cleveland and Los Angeles, one of the resources that they highlight that was really surprising to me was health. That people don't have health care here. And if people don't have health care, it's not surprising why they start to get upset. So I in the book, I kind of looked very closely in particular at two places where there was some of the most severe rioting, and that's my hometown of Los Angeles, particularly the Watts neighborhood in South Central Los Angeles, and Cleveland, which actually has a long history of civil rights activism and social movement activity. And, I kind of came to the conclusion that whatever you think of riots worked to actually scare the power structure in these two places. And as a result, there's a flurry of infrastructural spending on healthcare during the 1960s and 1970s as a result of this. This one case I look at might be particularly interesting because we're in Washington Heights and because we're next to a powerful medical center, the one that Bob and I work at, which is Columbia. But I studied this place in Cleveland that some of you who watch baseball games may know, the Cleveland Clinic. The Cleveland Clinic advertises relentlessly in sports games. Now, Cleveland Clinic, it has this modest sounding thing, like it's just this like little modest clinic. No. It looks like a spaceship when you drive by it, a luxury, expensive spaceship, glass, glitzy lights, and it's a place that actually the majority of the patients do not come from Cleveland. They come from around the world, and they usually don't need insurance. They will drop, $30,000 on a surgery with the top, quote unquote, top surgeon in the United States who does it. And I started looking at it because you can't really study what a university and academic medical center relations with the neighborhood around it without going local. And so I thought it was a really interesting way to go local. And one of the things I was surprised at, I narrated the history of first I kind of looked at just the history of the Cleveland Clinic itself. It started as a modest thing that you would call a clinic, and then from the 1930s to the 1950s, it just starts expanding, as did the medical center here, in the neighborhoods around it. And I had these two striking aerial photographs where you see the Cleveland Clinic in like the 1920s, and then you see it in the 1950s, and you see the expansion, and then you go, oh, wait, what happened to the people who were in the path of the Cleveland Clinic? And it was basically thousands of mostly black Clevelanders who were pushed aside for this clinic, for the Cleveland Clinic to continue its expansion. When the riots happened, the clinic got really, really scared. They thought about moving away from Cleveland. I found these memos in their archives where they were thinking about starting a paramilitary force, like a Cleveland Clinic, like a Cleveland Clinic army, in case like rioters would come into the Cleveland Clinic and attack. You know, none of this actually happened, but it just, the level of kind of racialized paranoia was kind of an index of how bad this clinic had treated, this institution had treated the people around it. But the riots sort of forced their hand. The Cleveland Clinic had to build this primary care kind of community health center, and so it was a concession to the kind of anger that manifested itself in the 1960s in Cleveland. It's also something that, again, makes you think about the potential of local action, but also the limits. Because the Cleveland Clinic, even after it said, okay, yes, bad, we're going to try to improve relations, we're going to try to do more for the community, we're going to build this clinic, in the end, it's still, if you drive by it today, a spaceship in the middle of a hyper-segregated, under-resourced neighborhood. People around it still are very paranoid about the clinic's constant expansion. And so it makes you ask, how big a victory really was that? You know, it was a marvelous clinic that they made. It definitely provided services to people who otherwise wouldn't have access to Cleveland Clinic medical talent. But ultimately, you know, the Cleveland Clinic still feels to me like an island. And so it kind of has made me wonder about what are the ramifications really of local action if at the end of the day the Cleveland Clinic is still sitting there in that neighborhood, more or less acting similarly to how it always has. The last case that I'll talk about, and then I'll quickly talk about implications and then bring Bob upstage, is two environmental health cases. So some of the cases in the book are about medicine and healthcare, which I talked about. And then there are these two environmental health cases, and they're kind of counterposed to each other. So one is the campaign to control smog and air pollution in Los Angeles, and the other is the rise of coal mining, particularly strip mining in the Appalachian region. And by Appalachia, I mean principally West Virginia and eastern Kentucky, a mountainous region that's extremely high poverty and did have a lot of coal seams there for energy extraction. And I kind of counterpose these two. The Los Angeles case really surprised me. So I grew up in Los Angeles. The cheap little hotshot everybody takes at Los Angeles it's really smoggy. There's lots of traffic. It's gross, and often that is the case. But the thing that surprised me when I kind of looked more into the history of it is that in 1940s, 1950s, LA was way worse than it is on its worst day now. Like, I found letters of people who said, I came out of my house and I started crying involuntarily. You know, that's I would come out and start wheezing and coughing, and it's true. Like, this is kind of like, you don't, on the worst day in Los Angeles, you don't go outside and involuntarily start tearing up. And so I was like, wow, so what changed? And what ended up changing is that Los Angeles enacted the most powerful air pollution laws in the United States. They actually became the basis for the Environmental Protection Agency's air pollution program. So the way the air pollution program, the way the EPA works is it says, here's a compound, and you can only emit this much of this compound, and if you emit more than that, if you emit more than this limit, we're going to start fining you. That originally came in Los Angeles, just this kind of no nonsense, look, if you emit this much, we're going to start fining you. That program started in Los Angeles. So I was like, well, why was it so successful, and why was it so embraced? And I found out that the reason was that Los Angeles had capitalists, but they were not capitalists with all the same interests. So you had your steel and oil kind of industrial capitalists, but then you had the other sector that Los Angeles is known for, and that's the real estate entertainment economy. And the real estate entertainment capitalists said, Los Angeles is not, this whole sunshine land kind of thing is not really going to work if we have like smog everywhere and tourists are like crying and wheezing. So essentially this non-industrial capitalist class forces the hand of the industrial capitalists, and they get cornered, and they basically say, okay, look, if we're allowed to operate, if you allow us to continue to operate, we'll abide by these kind of emissions caps. And so that's basically what the Los Angeles story is. The Appalachian story is the complete opposite. So that area has been so ravaged by energy extraction. You look at local newspapers there that were published in like the 1960s and 1970s, and you hear people writing about like rocks coming through their roof and destroying their homes because they're mining coal with huge tractors and bulldozers. You read about families who are living under a mudslide that is caused by dirt that has been that's caused by dirt that has been removed and not put back properly. And so the question is, well, why didn't something like Los Angeles happen in Central Appalachia? And the reason is that there wasn't this kind of inter-capitalist tension that people who are opposed to coal mining could exploit. There's basically one powerful industry in Appalachia, and it is the energy industry. And that energy industry is kind of like a revolving door. The people who are in the energy industry end up setting coal policy in the region, and so that's why there's no powerful allies that people who opposed coal had. The other wrinkle to it is that most of the coal in the United States until recently came from that region. And most of the electricity in the United States came from coal until recently. So essentially from the 1960s to maybe the late 1990s, the United States, the country writ large, was basically exploiting the energy resources of Appalachia to power the country. And so I have this sentence in the book, something like, the United States economic gain during this period came from Appalachian pain. And so, so this is an example of where kind of the national energy infrastructure exerts a huge power, in this case, a really awful power on this local region. All right, so I said I'd segue into Bob with just some thoughts about just what does this all mean. So the local battles in this book primarily end in the 1980s, around when I was born, and a lot has happened since then. The world is much more consolidated and interconnected. We have giant medical care networks now. Like most of my stuff in here is about maybe one powerful institution in a neighborhood like the Cleveland Clinic and little small kind of primary care clinics. But those have been far superseded and dwarfed by just medical group networks, giant institutions that gobble up hospitals. There have been a wave of hospital consolidations in the past decade and a half. Amazon is now getting into healthcare, as you may have noticed. Like they're running ads. There's soon going to be Amazon health storefronts. all over the city, and this kind of combo of consolidation and this consolidation may result in them wielding monopolistic power. I mean, we don't know, but the healthcare landscape is very different from the healthcare landscape that I write about in this book. It's much more kind of interconnected and conglomerated. The pandemic has kind of underscored just how interconnected the world is. One domino falls, 100 dominoes fall around the world. And then, of course, climate change. Again, this is not a problem that can just be solved on a single local scale, a single state scale, or a single national scale. You can be a nation that has the greatest climate policy in the world, but if the other nations aren't also participating in that together, it has some real limits. So I thought about all these things, all these kind of huge non-local global forces, and I'm like, wow, does the local really mean anything now in this age of consolidation, interconnectivity, and globalization? And I think in some ways that's our big challenge, because I don't know if local capacity and local political foment has the same kind of impact it might have had during the era I'm writing about. But on the other hand, consider this. So your conclusion from that might be, okay, yeah, this local stuff, cute, but a huge waste of time. It's really the federal and the global stuff we gotta pay attention to. But think about what we've seen in just the past few years. Like, global governance organizations have really broken down. Like on just climate, we sign these kind of toothless agreements every couple of years saying we're gonna pledge to lower carbon emissions. They're non-binding. There's no enforcement whatsoever. And even worse, in the last administration, as weak as those global conventions, climate conventions were, we pulled out of them entirely. So there's been kind of federal abdication of responsibility as a global citizen, in terms of global citizenship. So who stepped in that vacuum? It was actually local actors. Like mayors in the United States. Several cities said, okay, well, if Trump is going to pull the United States out of this, then we as cities who use a lot of energy and who have a lot of people, we're going to take the lead in this. And maybe if, Miami and Los Angeles and San Francisco and, Denver and New York get together and say, we are going to actually pledge to get under a certain bar in terms of climate emission. Maybe this is a local alternative to a faulty national policy. Other examples, the Green New Deal, if you actually read the resolution, is a very kind of community-oriented approach to things. It's not just saying, nationally we're gonna lower emissions at a certain level. It's a series of investments in local energy infrastructure in an attempt to convert them to something more sustainable. So I actually do think the local is not quite dead yet at all, and cumulatively enough local actions together may be a substitute in the face of federal abdication and kind of global convention, global governance institutions that are on very shaky ground. I do, in the end, though, argue in the book that it's not enough just to say rah-rah localism and localism is still alive. I use this phrase at the very end of the book saying that we need what you might call a multi-scalar health politics. So that's a health politics that essentially doesn't prize one scale over the other. Global is better, federal is better, state is better, local is better, but kind of realizes all of these things are connected, and then you have to keep your eye on all of these scales. And if that sounds abstract and kind of like hazy and non-specific, I think it is, because it's a challenging world. If I had this awesome blueprint for what we need to do, I think more others would have it as well. But I do think we are in a world where we have to kind of keep our eyes on multiple layers. But I do think remembering that this local scale, like acting on a local scale cumulatively, can actually add up to something beyond the local, is an important thing to remember. And the last thing I'll say is, for the people who say, hey, this local stuff is lame and we gotta focus on global stuff, federal stuff, how many of you think you actually have access to federal and local levers of power? I don't. I write letters all the time to my federal rep and I get no response whatsoever. People turn to the local because in an undemocratic, unequal society like the one we live in, it is literally the only recourse they have. And I think my book tries to show that in some cases, that recourse has had amplifying effects, both for the local region in question, but sometimes beyond that itself. And so I'd like to bring Bob up, and I got a question for you, actually.
Oh, sure.
Yeah.
You got a crowd.
Yeah, cool. So here's my question, and it draws on your experience in SNCC, which at heart was, I don't know if you're comfortable with this term, Bob, but at heart I think it was a grassroots local organization that had huge reverberative effects beyond the specific communities you were working in. I think when I teach the civil rights movement, I'm always trying to teach students, and I know you do as well, that the kind of civil rights iconography that they grew up with, the I have a dream speech and things like that, very important, but you got to remember that actually it was groups like SNCC doing the legwork on the local level. So with that as your background, what do you think of this conundrum where we're in a very different era than the era of SNCC? We're in this era where you see frightening levels of financial institutions financial institutions consolidating. In our orbit, medical centers gobbling up little local entities and turning into huge giants that dwarf anything in the 1960s and 1970s. Climate change was not really even an issue people thought about in the 1960s, and now it's this global issue that you look at it and you feel kind of powerless. So how do you, as somebody who cut your teeth in a local grassroots group, think about all these issues that seem so huge beyond the local?
Well, first off, thank you very much. I got to read this book. Typically, if you're going to be paired with the author, you had a chance to read it so you can make appropriate comments about it. But I'm really motivated to buy it, especially because I agree with everything that's been said. So the most important thing for this conversation is, for those of you who don't know me, I was born in 1944. That means I'm 14 months away from my 80th birthday. The 50s, 60s, and 70s, I was alive. I was engaged in a lot of the activities that he's referencing when he talks about what it was like back then. And to the notion that this is no longer the 1964 push to get African Americans registered to vote, bullshit. What happened in 2013? The Supreme Court decided that states in the South that had routinely denied African Americans access to the vote were told you don't have to tell the federal government whether or not you're still doing that. How many people that are part of Trump's campaign to deny the results of the 2020 election are now serving as the folk who will judge whether or not the election in their state was actually valid? We're still battling the battle of the vote. And to the degree that it's a way of limiting the power of the growing number of non-whites in the United States, I think you're all aware of the fact that by 2030, this will be a majority minority nation, that in the 2020 census, African Americans, Asians, and especially Latinx populations increased in size. White people lost. They lost. They had more deaths than they had births. And people are really clear that there comes a time when, if power is conveyed by who votes and what the vote in the ballot box happens to be, then the fight to control who votes, the fight to figure out under what circumstance will an election be held, is a battle that we fought in 1964, and we're battling it today. But you're also right that it was entirely local. What happened in the 1964 effort to get African Americans to vote in Mississippi, called Mississippi Freedom Summer, vaunted into prominence John Lewis, who later becomes a congressman, one of the most noted members of our elective bodies, somebody who fought based on what he had done as a local agitator in the civil rights movement to have national changes that really reflected what he thought was the most important part of the struggle for civil rights. Fannie Lou Hamer, a name that nobody remembers, but was one of those folks who came from Ruralville, Mississippi. She'd been beaten half to death for trying to insist that she had the right to vote. She becomes a national figure and almost has the capacity to ruin the opportunities that Lyndon Baines Johnson had to be elected president in 1964. You might remember 1963, Kennedy gets assassinated. 64 is a presidential election year where Johnson has to go from being a guy who assumed power because of the assassination of his boss, but who now has to confront Barry Goldwater, of all people, a very conservative individual from Arizona. Now, one has a sense that we continue to fight these battles over and over again. The names may change, the circumstances may change, but a lot of the dynamics are exactly as he's describing it. What we do locally has a lot to do with how we think and how we act nationally. The passage of the 1965 Voter Rights Bill was literally the result of all the actions that had taken place in 63 and 64 at the local level to make sure that people had access to the vote. And I continue to think that, because I say this in a lot of my classes, if you're going to do organizing for public health in communities, begin by organizing people to register to vote. Some of the things that we're concerned about in public health were so abstract and so difficult to grasp that you struggle to hold an audience. You struggle to give them the sense that what you're saying is somehow relevant for the things that they have to do day to day. But in a moment when everybody is aware, as was the case in Kansas, that something is on the ballot that needs to have local attention, that way of organizing people to think about some of the issues that happened as a result of the overturning of Roe versus Wade now gives those of us in public health in a state like Kansas an opportunity to do something local, because that local initiative was enough to spawn national attention. And I think that kind of back and forth, which is I think the tension you have in the book, is exactly what we're going to be playing on as we think about doing public health from this point on.
Yeah, no, I think that's right.
One mic.
No, I mean, abortion's an excellent example because this is a case where institutions at the federal level, both legislative and especially judiciary, are no longer an avenue. So we are sort of forced to return to the state and local scale. And Kansas is a great example because it does underscore how I think a lot of people were very surprised by this, but it does show you how important it is for kind of local level, micro level activity in the face of what is happening at the federal level. Yeah. The other thing that abortion raises for me in terms of thinking about localism is until some kind of reproductive rights and reproductive justice strategy post Roe is put into place, the most important thing right now, I think, besides campaigns like Kansas, is just supporting abortion funds and ad hoc, maybe you might use the term mutual aid type groups who are literally improvising to provide one abortion at a time. I have, like a lot of people, some kind of uneasiness with kind of mutual aid and like local level grassroots initiatives that don't occur within any kind of institutional framework because it doesn't seem structural and systemic enough to me. But this moment has really changed that for me because that kind of conclusion is of small comfort to somebody who really needs an abortion here and now in those states.
The other thing that I think is worth pointing out is that certainly with work I do with prisons, it becomes very clear that the system of mass incarceration in the United States is huge. I don't think there's anybody in this room who hasn't heard the statistic. Here in the U.S., we're 4.5% of the world's population, but we incarcerate 25% of the world's prisoners. Well, that series of facts describing the scope of mass incarceration is basically what we find when you add up locally how many people are in a place like Rikers, how many people are doing time in a place like Bedford Hills, one of the 3 facilities for women here in the state of New York. And a lot of prison reform that will happen nationally really will begin with what happens in local settings like what you're seeing here in New York State. So you have a national problem that is well summarized by the large number of folk who are doing time behind bars, but all the work that derives towards abolition, all the work that drives towards reform is ultimately local. Because we're not talking about what happens in the federal prison system, for those of you who know the difference between what happens in the state and what happens at the federal level. For the kinds of things that impact life here in Washington Heights, where in the facilities I've taught in for the last 12 years, there are a substantial portion, typically at least 20% of the men who are in classes with me in the Barred Prison Initiative are folk who are from Washington Heights. And they always want to know, well, what's happening on 165th Street? So I'm very clear that when people get out, they're very clear that they want to continue to work to do something to improve the quality of life behind bars in the state of New York. They're not only militating for something that has local significance, it also has national significance as well. Now that Pell Grants have been authorized so that you can begin to have prison programs that allow for college behind bars, you're going to see a lot of the local efforts like the Barred Prison Initiative now become national movements because people want to emulate the same kind of success that occurred when all of a sudden, for a population that typically comes home and struggles to stay home, adding a college education, adding the kind of formal training that education behind bars can provide will have a dramatic impact on life in communities where people are no longer a burden on their neighbors. They're folk with jobs who can contribute to the life and to the tax structure that the community is able to put together. So the idea that in public health we work locally, but sometimes what we do can have national significance can't be overlooked. Maybe the best place to have seen this was with HIV/AIDS. If you look at the history of the CDC's funding for efforts to control HIV, now that we're struggling with monkeypox, where it looks like you may be dealing with the same set of issues in the social and sexual networks that people are involved in, it became very clear that we were talking about a national problem, but that if you wanted to effectively deal with all the issues that the pandemic was raising, you had to figure out how to operate locally. Some of you know that the history of work in public health and HIV/AIDS begins with the DEBIs, DEBI, the dissemination of effective behavioral interventions, which were all local efforts to figure out how do you deal with the population that is at risk or is being treated for HIV. Figuring out how to go from effective local programs to present something at the national level is an ongoing struggle, especially of the type that we're having in COVID-19. And everything that helps us figure out how to pay attention to what's going on locally, because the potential that it might have to impact nationally, it seems to me is at the core of what you're trying to do in the book. Now, I'm curious to know from your standpoint, what do you take from COVID-19, since I'm betting that you started writing this before COVID was really hitting home?
Yeah, no.
And when COVID hit, I was like, oh man, I didn't write a book on infectious disease. Whoops. But no, I would say COVID. So the initial analysis that I and a lot of people had about COVID was on local differentiation, right? Why is COVID so bad in this state but less bad in that state? Or why is it so bad in a country like the United States but relatively good in a country like Vietnam or South Korea? Over time, it became harder for me to sustain a thesis that well, that's actually where I started thinking about the need for thinking about things in a more multi-scalar way. Because one of the success stories in COVID in early 2020 was from Kerala state in India, which is a state that has has had a series of small c communist legislators who are also really gung-ho about public health. everything you wish the United States did for COVID was happening in Kerala, like, testing on very easily accessible testing on the street, community health workers coming to your house if you were isolating to make sure that you had the resources like food to be able to isolate, a working public health system. And so Kerala, and it showed in the initial numbers, like the rest of India had rising numbers, Kerala didn't. So my whole thing was like, why can't, we need to actually export the local Kerala model around the world. Then something happened. The Kerala numbers suddenly started spiking upward, despite this glorious public health system that they have. And so I was like, why was that? And it turns out Kerala is also located at a route where a lot of seasonal migrant workers from Southeast Asia passed through, and they were bringing COVID with them. And they had no choice but to kind of accept. I mean, seasonal migrant work, that is the nature of it. You have no choice. This is really the only kind of economic resource that you have is to take these seasonal jobs. And so I kind of underscored for me that even if you had a glorious system like Kerala's, a local system that was ideal in many ways, you couldn't insulate it from the rest of the world. Like, even Kerala is not immune to the political economy of labor in capitalist society, which depends very heavily on migrant labor. So this is the question. The challenge for me with COVID is actually it was one of those moments where I kind of realized, you can do everything right locally, and that's not going to be enough. So it's kind of in our public health language, we have this like phrase, necessary but not sufficient. That's probably how I think of local now. And that's probably how I think about local for any of the things that we've been discussing, even if it may be the initial entry point and the only entry point we have to hopefully cascading into larger change beyond a particular local effort. I mean, here's a counter point to because I think the HIV/AIDS example is probably one of the best examples of how strong local action in a few key sites can later reverberate and have national and frankly international consequences. A flip to that I've been thinking about, like a foil, is a movement that I'm actually very sympathetic towards, in some ways part of, and it's the environmental justice movement, which is worth talking about because in Washington Heights it has a very huge presence in the form of We Act. But I think one of the problems that has bedeviled environmental justice is you often have a huge victory here, a huge victory there. You stop a bus depot in this city, but it doesn't quite seem to cohere into something larger. It feels more like the whack-a-mole game at a carnival where you hit one beaver and then another beaver comes up. And this is often what happens with an environmental justice victory. So you get the victory, and then what happens? The industrial giant just moves up the street to some other community that perhaps isn't going to be as successful politically. So I've thought about what makes some local actions successful and able to kind of consolidate into something greater than themselves, and why there are some local actions that seem sort of permanently atomized or permanently doomed to just be kind of one-off victory after another one-off victory. I don't know. Do you have any thoughts on that? I mean, I wonder if some of it is just the nature of the problem. Maybe there's something about local environmental struggles that's different from local HIV/AIDS struggles. But I think it's worth thinking about. Why some seem to be able to have kind of the ACT UP HIV story, and other movements seem not to be able to do that, and are always just stuck at fighting one neighborhood fight after another neighborhood fight, but the neighborhood fights never totally adding up to something greater.
Yeah, I've definitely had the sense that there are definite limits to what happens locally. And interestingly enough, it is not a function of whether or not the battle is a pathogen like COVID-19, or whether or not it's something that's much more generalizable like sources of pollution that cause asthma. It seems to me the issue has always been, how good are you at organizing local folk to do the work of fighting for themselves, for their rights, or for the fundamentals that will promote their health. I'm always amazed at what people are able to organize for successfully. And I'm always astounded that some of the things that look as if they'd be easy are often really, really, really difficult to get underway. I don't know how many people were completely fooled by the set of elections we had most recently, when it became very clear that members of communities like this one or Harlem, folk in communities of color, tend to be a lot more conservative than us well-educated progressive types, that Mayor Adams won because people liked the idea that this guy was a cop who was going to do something about crime. If you live here in Washington Heights and ever attend the 33rd Precinct's monthly Community Advisory Board meetings, you get kind of a sense of why it's so difficult for progressive radical ideas to take hold, especially around something as simple like policing and crime and mass incarceration. Number one, there are a lot of folk in this community who are very proud of their sons and daughters who enter the police force. It is a viable way of entering middle-class life. And you are respected if you're somebody who has done that. So the idea that all cops are demons is simply wrong. It's a progressive notion that in the face of structural racism seems easy to sell until it becomes an election issue where folk have to really decide, is this what I want? Second thing about attending those meetings is how much life in this community, if you're an old person, my age or older, who's kind of struggling in an area where sometimes you're just a victim. Talking to people in prison for the last 15 years has made one thing very clear. You are successful as a criminal if you don't pick on somebody who's likely to hurt you. So the idea that old people are the natural victims of most of the crime that occurs in a community like this means that the minute you start to sell, let's defund the cops, there are going to be a lot of people who think you're taking away the one protection I have that allows me to stay in a community like this one. And I'm suggesting that a lot of what happens in the ways in which we take the global statistics we collect in sociology or in public health that look at problems like crime and punishment in a somewhat simplistic way is that we don't often take into account what it feels like and what it looks like from the local perspective. Because statistics allows us to abstract ourselves from the living experience of people. A lot of times we're really surprised when that lived experience produces a very different ideology, a very different notion about how you're supposed to act in a community like this than the one that would seem to be suggested by our theories and our notions about political action and what you're supposed to do to confront something like structural racism. So I keep thinking that the success of local efforts is always how well do we understand the folk who need to be with us in any concerted, organized action that we put together to make things better. If what you're going to do depends on the creation of an intervention where people are ready to move in support of their own health, their own safety, and their own security, then part of what you have to be clear about is what is it going to take to convince them that this is worth their time, their energy, and whatever struggle is going to be involved in making an organization that really works. So whether it's COVID-19 or whether or not it's problems with pollution, if it's going to be a problem that can only be righted by having local folk organized to do something about it, then it's the quality of our ability to organize and not the nature of the problem that seems to me is the challenge. True, there are some things that you can organize more easily than others. But it seems to me that if you ever do community organizing, it becomes clear that shit is hard. It is really hard. And as a consequence, one is never surprised when a community organizing effort fails. Because in my experience, that's really part of the game. We're often trying to fight a battle with few resources and with not enough in the way of excitement about what's going on to make it possible for us to sustain our action. A lot of movements that begin when people are angry can't be sustained because anger doesn't last forever. So again, the whole issue for me is not so much the nature of the problem, it's how good are we at organizing local responses so that they become a part of what we're able to put together to make things better.
Yeah, one of the things in the book that really seemed obvious in retrospect, but you really needed to kind of see it to have it crystallized, was something you just said, Rob, which is something I think a lot of my students, as particularly politically active ones who read a lot, initially kind of downplay. So often when they're talking about social movement success or failure, they're talking very kind of heady political theory type of stuff, and you got to have these three preconditions, etc. This theorist says that. But actually, I found one of the most important things when I was writing this book was just the importance of good interpersonal skills, which is actually a rarity in some ways in political organizing. But I'll tell you, there's one story from this book. There was this, so I mentioned that the riots catalyzed a lot of community health infrastructure, and one of the things that resulted from that in Los Angeles was in Watts. They built at the time $2.4 million community health center. $2.4 million in 1964 dollars is a lot of money. So this was like a big investment in healthcare infrastructure for Watts. And it was funded by the federal government. There was going to be a lay community board. And then the big question came is, who is actually going to serve on this lay community board? And there were a lot of fights about who could properly represent Watts. Would it be old people, young people, people with fancy degrees, people with no degrees? And this community organizer who, he would write these memos, but they were like poetry. And I printed just some excerpts of them in the book. But he had this sixth sense organizer skill, because he really said, I get why everybody is fighting over who should be on this board, and these are the reasons. This group of people in Watts thinks this way. This group of people is he was actually referring to some of the black physicians in Watts is actually threatened by the idea, very understandably, of some kind of thing being plopped into their neighborhood. He just had a great sensitivity for these kinds of interpersonal dynamics, and was able to actually work out some kind of conflict resolution. I find that's just a very rare skill. It's more of an art than really kind of political understanding. But you're absolutely right. Having that organizer sense. Should we go to the floor, Vern? Yeah. Does anyone have any thoughts or questions?
Ow! Yeah, so I had kind of a question comment. Because both of you in your writings and your talks speak to the place of place in making a difference in organizing. I know, Dr. Bob, you related an incident about how important it was to sit down at a kitchen table with someone in the Mississippi Delta in order to get them to buy into change. And you talk about the successful health clinics that involve local advisory bodies in order to be successful. So I know it's difficult to talk about making local place the place to be, but do you have any suggestions or ideas to help formulate making working on place important? Showing up to someone's house for dinner could be one thing, or doing what Word Up Bookstore is doing here, because we have a local educational forum among the young audience, students, I would say mostly, but could this type of forum be transportable and duplicated so we could take Word Up Bookstore forums into senior centers or NYCHA centers to give people an experience of what it is to have an educated but local home folk discussion?
Well, my thing has always been know the history of the neighborhood that you're working. So the fundamental premise for people who are doing social work, education, or public health is, you're not only present in the community doing a job, the community should know you, should know what you were about, and you should develop a kind of a rapport that has people trust you and what it is that you're trying to do. So the question of how best to do that, do you read the statistics that describe the demographic circumstances of the neighborhood that you're in? Or do you come to events like this? Or the old forum community organizers of the 50s and 60s went to the local bar. If you wanted to find out what was going on, you wanted to know the dirt that was at the core of a lot of local politics, the bar. After the third glass of beer was a point where you were not only get folks interested in discussing what was going on, you'd hear something about the history of the neighborhood. How did we get to where we are now? For example, coming to Washington Heights at this point in 2022 is nowhere near what it was like when I got here in January 1990, when right across the street there were a whole bunch of things going on that had a great deal to do with the sale and the use of crack cocaine, which was problematic in this neighborhood in ways that folk have almost forgotten. But in order to figure out how to do the work of public health in this community back then, you had to be in a place that a lot of people thought was dangerous. Many people talk about this because it is certainly what I recall from the early days of being at the School of Public Health, was how often students were told, whatever you do, after 5 o'clock, do not cross Broadway. Stay on this side of the tracks. And the idea that what you had to do for people who were going to do public health in a community like this was not suddenly decide that there were places where there were them, and then there was a place where there was us. Figuring out how to operate and be effective locally meant you had to be in the places where people were. You had to see things through their eyes. You had to learn how to speak the language, to use the words the way they used them. And then when you had something to say, when it was your job to be convincing, when you were trying to organize people to do something, at least you knew to whom you were speaking. You knew exactly the impact that your words would have, and you'd have a sense that what you were saying was falling on familiar ears. So yeah, everything about doing this work is often meant that you have to look past the numbers. You have to look past the myths and the legends about the place that you're in. You have to learn the lessons of history, and then you have to take advantage. Great question. Thank you.
No, I agree with everything Bob has said. I would just say one thing that might, I think, kind of touches on institutional incentives for how we think about public health and how we don't think about public health. But in our world, or other world of academic public health, it is like kind of the statistical abstractions that are prized, and also what I would describe as flashy things that seem like they're quote unquote big issues. And so I remember this I think the roots of this book and kind of my gravitation towards the local level came out of a real sense of discomfort when I was a graduate student, when I was getting my master's in public health. So I got my master's in public health at the University of Pennsylvania, which neighbors West Philadelphia. And it's a schism you feel as a student there. And I remember the public health and medical school there was always, it was like proton therapy or like, grandiose public health projects that were global health projects. It's like Penn saving the world sort of narrative. And everybody was attracted to that stuff. And I wasn't. And I was like, well, you have, as important as it is to do to be aware of the wider world, you also have this world like literally at your doorstep that is very under-resourced and that could use some study and attention and isn't getting any. And I think this was not just the case at Penn. This is the problem in like the public health enterprise in general and the sorts of people who run it and foundations and that sort of thing. And so I think part of the strategy is to just reassert the importance of place and not just write it off as this like little small donuts thing, but actually the biggest thing, because this is actually where people form their ideas and are first taught the things that they need to do to politically mobilize. And everybody in public health wants to quote unquote change the world, but the place you do that, I think, is actually on this kind of micro intimate level. and not kind of the more grandiose stuff that everybody is attracted to. I will say, I mean, what do you think about this, Bob? Like, I have noticed that cautiously, but some of the philanthropies like RWJ and Ford Foundation have in the past 5 to 10 years taken a huge interest in like local communities and capacity building and community organizing. I mean, sometimes they kind of do it in philanthropy babble, but you know, I think they are a lot more interested in it than they were 10 years ago, and that's a good sign. I mean, is this your feeling?
Robert Wood Johnson is the classic example. Cultures of help.
Right.
I used to be a funder, so whenever I get an opportunity to talk about the way in which, as a nation, we spend money either through federal sources, state sources, municipal sources, or through private philanthropy, we're often looking at something that changes depending on the era that we're in. So I was a federal funder in the 1970s and 80s. I was in education. So I was present for the transition from Jimmy Carter, who was really good at a variety of things, but terrible as a guy who was running government, to the Reagan administration. The Reagan administration comes into education saying we're going to get rid of the Office of Education. And instead what they do is present and create a cabinet level position. The Secretary of Education is something that only happened in the US government beginning in 1980. But this is something that Reagan did. And what was it that becomes very clear about the way in which philanthropy does its work? Ultimately, it has to pay attention to the political process. When Trump was in office, and it was very clear that a lot of progressive issues in public health were not going to be financed by the federal government, it was the job of private philanthropy, the Ford Foundation, the Mellon Foundation, Robert Wood Johnson, to step in and fill the breach. People don't really pay much attention to that, but this is often what drives a lot of the public health that we do in a place like New York City. One of the most important things that happened to HIV was when private philanthropists got together and had the Funders Committee on HIV/AIDS, where all of a sudden they tried to do their best to assure that funding that they were providing when there was an absolute vacuum. You might remember that Reagan was a guy who could not even say the word AIDS. When his buddy Rock Hudson died in 1985 of HIV disease, it was the only time he even said one word that seemed to acknowledge that it existed. So what that meant was private philanthropy was going to have to, at that very critical moment when we were struggling with this virus, had to fill the void that was simply not present when the federal government could only through the back door acknowledge that this was a public health crisis we had to deal with. So you're right. Yeah. At this moment in time, I think it's largely because of things like the murder of George Floyd. We're very aware of how much something like structural racism requires that you deal with the problem at the local level, not just the national level. And much of what I've seen from Ford and from Robert Wood Johnson in particular, both of whom are headed by people of color, has meant that we've really seen a shift in what they think is really important for funders to do in the absence of a federal presence to make sure that some of the things that we value in public health are going to continue to get funded.
I just wanted to continue your reflection on the role of public health education, such as Columbia University, other universities. I mean, you spoke about abstraction as a function of statistics, about the role of tables and some of the public health science that may not necessarily equip us or help us understand the local dynamics or navigate the local situations or build or organize local communities toward purposeful action. What is your reflection on the role on the current role of public health education in general? What kind of skills that are missed? What kind actually, like, as you were speaking about proton therapy, I mean, my mind was going, oh, it's what's happening here is perhaps it's some form of distortion. It's not even an empowering for people who would come to public health schools to gain skills toward local action, if we may put it in this way. So what is just your general reflection on?
So I think there's someone in the audience who might have an addendum to that. Do you, Ricky?
Or can I answer from like a current student perspective?
Yeah, so I think one thing, well, the three of us are all in their department, the Sociomedical Sciences department, and it's very like theory based. And something that I'm missing is the practice, which you are required to do like a summer practice experience, but they're not all paid, so that's the tricky thing. And I think the issue of funding, and so like a lot of thinking toward graduation now, because we're in the second year, how do you pay off your loans? So going into like healthcare consulting, but I think the frustrating thing for me was, okay, we're at this really fancy school and we're not learning things that you can't be taught in 5th grade, I think. Not like all the math stuff or whatever, but like the history stuff, like the discussions on history and having these critical discussions about race or understanding what race is.
Yeah.
And the difference, all these different things, like I think at a theory level, whatever you want to call it, I think we can be taught in, more, maybe like less fancy words or whatever, but I think it can be taught earlier and sooner, and that's something that's like, I find really frustrating, but important to me, and something maybe I think that can shift the way we think about not just public health, but health and education.
Yeah, no, I mean, I totally agree with you. Here's what I think might be the issue in public health education. I'd like to know what you think, Rob, too. And Bob has a secret life because you were a statistician, right? That was it. You're right.
Busted. Oh my God.
But I think there is a tension in public health education where one faction only wants the statistical stuff because they view it as value-free and quote-unquote objective and scientific and rigorous, and views any discussion of political power and power differentials and marginalization and exploitative as kind of muddying the scientific water. And so I think what Ricky is describing and what you might be describing is that tension playing out. My view is that the statistics stuff is hugely important. I would hope someone in public health knows how to count and make charts. But I feel there is a discomfort in the field with complementing that with and admitting that many public health problems, maybe most public health problems, are actually caused by inequality and imbalances of power and people, the bullies, stepping on people who have no power. And I think this is something you see certainly in our department and the school at large, is people who fall on different sides of that. I wanted politics in the title of this book because I fall on a certain side of that. I say if you wanna address public health problems that we know stem from racism or poverty or the maldistribution of resources in society, you can't do it by blotting that out and pretending that it's merely a quote-unquote scientific problem. So I think that's what you might be experiencing as a student. What do you think, Bob?
Yeah, I do want to say that there are a number of important strains within contemporary public health education. I'm a guy who does a lot of work in communities. So I teach an evaluation class where I've got people in the class working with community-based organizations around issues of evaluation. It's less about what's in the texts, about how do you do quasi-experimental designs, and everything about what is it that they're trying to do, what kind of data do they collect, and to what degree does the information that they gather help them guide what it is they're going to do next. So that form of service learning is going to be, I think, an increasing part of what happens in public health education, literally because of COVID-19. We've got an enormous opportunity to right all of the errors that we created in our communicating with the public during the course of our struggles with this pandemic. And I'm trying to get as many people to work with Coach Dave, who was the reason why a lot of you showed up here tonight, because he's somebody who's been working in this community forever. He and I and Mindy Fullilove go back 18 years where we've been doing this thing, Hike the Heights. And do I have some Hike the Heights folk here? Is that you, Audrey? So there's a public health graduate who cut her eye teeth working in this community, and even after she graduates, she continues to sort of work with some of the folk here because they have figured out that if you do this work, you are really coming closest to the ways in which public health is supposed to operate. So the more I get folks to see the value of that, the more folk come away from their experiences in the community being clear that they understand how you go from the abstract stuff in the text on public health to actually making it real in the streets. I think the better our education is likely to be. But it's an uphill battle because in many instances, NIH isn't willing to fund the kind of work that I do. The CDC isn't interested in working with community-based organizations if it appears as if we're using government money to overthrow the established order. NIH has made it real clear the revolution is not going to start with our funding. So the tension in public health is, how do you pay the bills of the institution? Can I get an amen from my 3 public health students in the front? How do you pay the bills but do the work, the righteous work that public health is supposed to be about? You have, with your question, I think touched on the most important tension that exists in public health education at this point in the 21st century. Bravo. So are you graduating soon or are you just starting?
I still have maybe 3 years or so.
Oh, 3 years. Okay, good. Well, we'll
Wait,
talk.
3 years? What degree is this?
The RPN.
Ah,
Purgatory.
Are we done? You were worried about time.
Yeah, I think I was just. Is there all everyone's questions? There's more questions. I just good. I think one. Yeah.
Yeah,
Thank
thanks
you.
for coming.
Yeah.
I appreciate it.